following program is pre-recorded.
The opinions expressed on this program are those of the host, guests, and callers, and not necessarily those of this station, Salem Media Group, staff, management, or advertisers.
Welcome. It's time to transform your family's health with one of the nation's leading authorities on total health. We'll bring you into a world free of disease and physical pain. Learn how to revolutionize the health of the ones you love most. Your host is the wellness physician for the Sports Performance Council for Team USA and founder of Revive Chiropractic in Lewis Center, Ohio. This is Revive Your Health Radio, presented by ReviveChiro.com.
Welcome, everybody. You're listening to a brand new episode of Revive Your Health Radio. I'm your host and lifestyle expert, Dr. Brendan Schreiner, and this is a show where we work to renew your hope, rebuild your health, and revive your God-given potential through the 5 essentials of health. This weekend, we're all about pinched nerves. I hear this all the time. You know, someone comes in and says, my doctor diagnosed me with a pinched nerve, or I think I have a pinched nerve. AKA what that means is that you have neuropathy, sciatica, something of those sorts. That's more the scientific term. But everything from the cause to the cure, we will cover this weekend. Before we get into some of the amazing opportunities, why this? People ask me all the time, Dr. B, you've got a pretty crazy story. Why did you become a chiropractor? Well, I became a chiropractor not because I thought it was a great idea. I actually didn't necessarily like chiropractic in the beginning. I was going to be an orthopedic surgeon, doing total hip and knee replacements, and literally chiropractic saved my life. I wrestled for the Ohio Bobcats. I got a scholarship to wrestle there. Redshirt freshman of the year. On my way to potentially All-American, and that was my dream. I mean, that was really all I knew, and that's really all I worked towards was trying to be the best. And wrestling paid for my school, and if it was something that I couldn't do, then it would have been a pretty hard time for me to be able to get through school. But anyway, I woke up, I think it was my 2005, getting ready to wrestle Central Michigan. And I'm just doing some drills, I'm cutting weight, and everything was fine. I didn't have any issues. I didn't have any signs or symptoms of having any kind of neck problems or anything like that. And literally the next day I wake up and I can't feel my right hand. I mean, there's these, 3 fingers on my right side. I couldn't feel it. My neck was kind of stuck to one side. I couldn't move it. And if I moved it to one particular point in time or side of my body, my hand would go numb. I'm, in the middle of finals. I remember, physics, organic chemistry, just a horrible time. I did all the traditional things. Went to the training room, ice, heat, and stem, 800 milligrams of ibuprofen, end up going, up to Lancaster, Ohio, and a really awesome doctor up there was doing injections through the front of my neck, which is actually a procedure they don't do anymore. So they would lay me on a table, they would give me Valium to kind of numb me, and then they would actually stick a needle through the front of my neck, about 6 inches long, and it would be a dye that I would swallow to make sure that they wouldn't hit an artery or any kind of neurology they shouldn't, and they would inject the disc with a corticosteroid shot to de-inflame and to potentially take pressure off. And wouldn't you know it, I felt better temporarily. I'll talk about that here today. But then literally a couple weeks later, it all came back. I went to get my spot back at 149 pounds. A kid put a power half on the back of my neck. And if you don't know what that is, basically someone drives their elbow into the back of your head and just wrenches on your arm, and I heard a pop, and it was over for me. I knew that it was over, and I think it was a month later, I ended up having a titanium plate fused into my spine. They took my 3-dimensional spine, they fused it with a 1-dimensional plate. They went through the front of my neck and bolted my C5, C6 together because I had a disc herniation that was bulging backwards into my spinal cord, aka pinched nerve, creating tingling, muscle twitching, and things like that. Once I had the surgery, I immediately felt better. But then months later, I ended up having debilitating migraine headaches. I started getting tingling down the left side of my arm. And I ran into a chiropractor one day, and he said, "Hey, let me take an x-ray of your spine." And he took an x-ray, and my neck was -6 degrees in the opposite direction. It's called a military neck, or a reversed curve. It's what people often get after really big car accidents or a whiplash injury, but it was from just repetitive wrestling and football and car crashes and just being a rough and tumble kid like most are. And he said, this is the reason why it is that you had the problems. This is the cause. All they really did was go in there and treat the symptom. And I was angry. I was upset. But literally over the next 6 months, adjustments and rehab to my neck. I was off all my medications. I was stronger than I had ever. They told me I was going to be. They said I was really going to never really do anything physical over my head. I would be limited. And that was just all put behind me. I went down to chiropractic school. I got my chiropractic doctorate in chiropractic. And my wife and I met my wife down there. And now we have one of the largest natural health care clinics in the country. And by the grace of God, that happened to me. I thank God every single day that that particular struggle happened to me, because I wouldn't be able to influence and lead so many people back to health. And that's why I do what I do. And that's why we're talking about pinched nerves today. That's why we're talking about neck issues, back issues, because there are better options out there, definitely better options out there than just pills, drugs, shots, and surgery. And I would even say physical therapy a lot of times, and stretching and yoga, are okay, but that's also just one piece of the puzzle. We've got an amazing opportunity for you to kickstart your healing journey this week. As always, we've partnered with the Driven Foundation, Roy Hall Jr., and Antonio Smith. Let's hear a little bit about the Driven Foundation from my good friend, Roy Hall Jr.
This is former Ohio State and NFL wide receiver and Driven Foundation Executive Director Roy Hall. When I played for The Ohio State University, our head coach, Jim Tressel, always encouraged us to make a difference in the community. Since 2009, the Driven Foundation has distributed more than 1.3 million pounds of free food to Central Ohio families. The Driven Foundation is partnering with Revive Chiropractic to impact families. When you visit Revive Chiropractic for a new appointment, $20 will be donated to the Driven Foundation. Go to staydriven.org for more information on how you can get involved with the Driven Foundation.
Thank you so much, Roy, for everything that you do with the Driven Foundation. You're just a true servant, and blessed to have you as a patient and also as a friend. So here's how this works. This appointment is normally $170 if you were just walk in off the street, but we discount that to $69. We've always done that on the radio. That's an amazing value for what you're going to get. But we've decided that we want to make the Driven Foundation a partner of ours. And so there are kids, there are families in need right now. And so 20 of that $69 is going to go towards, from your new patient appointment, it's going to go towards food, clothing, leadership, and the gospel of Jesus Christ to families all around the city. Something that we value in this clinic is our faith and the faith of others around the city. And we also want to make sure that we're giving people clean food, clothing, and really Roy and Antonio Smith and the Driven team, they just do an amazing job at leadership. So that $69 for that new patient appointment is going to include all your digital x-rays if necessary, your case history, everything that we really need to figure out the cause of why it is that you're having the issues with these pinched nerves or neck pain. And then we're going to actually go over that with you on your next visit, which will be with me, Dr. B. That first visit's with Dr. Mary. She's been with me for 25 years, takes about 30 minutes. It's very simple. All you have to do is give our office a call. The lines are open, so you can call now, 614-781-8808. Once again, that's 614-781-8808. So here's what you're going to do. You're going to leave a message with your name, your contact information, your reason for calling, and one of our staff members will be contacting you on Monday to get you scheduled for that amazing appointment. Like I said, this appointment takes about 30 minutes, and we do take all forms of insurance, so make sure you bring that insurance card with you to that first visit. And then once we actually get all the diagnostics together, we have a clear plan of action, and we know exactly what to ask your insurance for. We will call them, and we will see what that looks like after we put together a customized care plan for you. You can also go to revivechiro.com. That's revivechiro.com. And you can actually make that new patient appointment online. Just make sure when someone calls you, you let them know that you came from the radio, but you're scheduling online. Last thing is that we do take that payment over the phone. Yes, we will collect that $69 over the phone to hold your spot. If for some reason you do not pay that, then your spot will be given to somebody else. We have a very, very large following. People come from 2-3 hours away, one way to come see us from the radio. And so we have to hold our x-ray room And so individuals that pay, we know you're committed. That could take away a life-changing opportunity from someone else if you do not show up. So we will take that $69 payment, and that 20 of that will go back to the Driven Foundation to be used for food, clothing, leadership, and the gospel. Cannot wait to see you guys in the office. This week on Revive Your Health News Update, we're going to look at a study in the British Medical Journal back in 2017 discussing what works and what doesn't when it comes to neck pain. Let's look at the science, shall we? So from somebody who's gone through, neck pain and, surgery, obviously from my story earlier in the show, this study kind of really hits home to me. And I think a lot of people, we live in this culture where it's like, if I'm in pain, I go to the doctor, I get an ibuprofen, I get, whatever to treat my symptoms. But I want to kind of go through here. This is what the science says. And this is the British Medical Journal. This is one of the top leading journals in the world, what it says about NSAIDs and shots and even surgery. And what does the research really say? So this is what it says. Neck pain imposes a considerable personal and socioeconomic burden. It's one of the top 5 chronic pain conditions in terms of prevalence and years lost to disability, yet it receives a fraction of the research. This is what it says about this. So muscle relaxants and non-steroidal anti-inflammatory drugs, aka, ibuprofen or aspirin or Tylenol, are effective for acute neck pain, right? So if you want a quick fix, take that. In clinical practice, is mostly guided results of studies performed from chronic neck pain conditions. However, strong evidence says that pain medication is just symptomatically for short term. That will come back. It is not going to fix the cause of the problem. This says that alternative treatments, and the strongest evidence lies within exercise, spinal adjustments, and things like massage, yoga, some physical therapy type stuff. So if you want to have the strongest evidence and actually changing and actually getting to the cause of neck pain, has nothing to do with shots and pills, has everything to do with exercise and spinal adjustments. It also says here that there's weak evidence to support epidural, which is steroid injections, and radio frequency denervation, which means that they actually kind of burn the nerves off. Surgery is more effective than conservative treatment in the short term. But in the long term, they say that individuals that have surgery, but you don't actually fix the cause as to why, or the structural issues with the spine, 9 times out of 10, those individuals are going to have more problems, aka more surgery. So the strongest clinical evidence comes with exercise, which is stability, what we do in our clinic, chiropractic adjustments, massage, and that's what the research says, right? So if you want to fix the cause of your problem, stop taking pills and shots and waiting on the surgery. That's just the traditional course of care. Here's some medication, here's some muscle relaxers, then we'll go to epidural, then we'll go to physical therapy. If that doesn't work, then we'll fuse your spine together. There are other better options out there, and the research proves that. So what's the takeaway here? Pills and shots will never fix the cause and will only lead to further problems. Surgery should never be your first option. Never. If I could do it all over again, I would have done everything that I possibly can to correct and fix this. I just didn't have anybody to lead me in that direction. The standard course of care is exactly what I just said. Pills, shots, physical therapy, and then surgery. And so there are other options out there. If you're looking to find the cause, chiropractic is your way to go. So one little thing here before we kind of get into some of this, the nitty gritty behind chiropractic and just the structure of the spine and really why it is that pinched nerves actually happen. Like what is exactly a pinched nerve? We did an amazing health transformation dinner a couple weeks ago, and I want to talk about our next one coming up. If you want to go more and more in depth on mental health, depression, anxiety, ADHD, I have a ton of people that I just hear randomly. I'm out on the street. I'm just talking. We're in a pandemic or an epidemic of mental health problems. And so our health transformation dinner is going to be with my wife and myself, Dr. Samantha. It's going to be on March 20th, 6:30 p.m. at Little Bear Country Club right here in Lewis Center, Ohio. It's going to be all about mental health. So what are some natural strategies that we can use when it comes to gut health and how that affects the brain? And how do we begin to find the cause so we can get off of some of these SSRIs and some of these really toxic medications that create long-term negative health benefits. All you have to do is just give our office a call. So when you make a new patient appointment, just let our staff know, hey, I'd love to come to that dinner. It's free for you and a guest. All you have to do is give our office a call, 614-781-8808 to register for that dinner. It's completely free. I've also partnered with a gentleman by the name of Damian Buck, really awesome. He's a world-class meat smoker. We have all the food catered in. It's all organic. It's clean. You know, one of the people that came to our last dinner, she goes, I love these things, but I can't ever come to them because, I've got such massive health issues that everybody always gives me crappy food and I can't eat. Well, we don't give our patients crappy food. We give them quality food that we eat and that we want you to consume. So you're going to be able to experience all of that at this upcoming community dinner on March 20th, 6:30 p.m. You must RSVP by Friday, March 17th, so we know exactly, one, how many people you're bringing and any kind of food restrictions that you may have. So can't wait to see you guys there and in the office. I want to talk about structure equaling function. So this is something that we talk about in our office, that structure equals function. The spine needs to be structured in such a way that it allows the brain and the spinal cord to be able to function and to send life and information down the spinal cord, out the nerves, to your fingers, to your feet, but also other vital organs. And so the structure of your spine determines the function of how well your body heals and how well those nerves are going to function, aka if they're going to be pinched or not. So I want to walk you through like what a normal structured spine is supposed to look like. And before I do that, I just want you to understand that we have normal values. If you go to a cardiologist and your cholesterol is 300, they're never going to say, well, sir or ma'am, what's normal for you is not normal for me. So let's just ignore that. You're never going to go to an orthodontist and they're going to look at your teeth that are really crooked and they're going to say, well, what's normal for you is not normal for me. No, they were going to say, we're going to put braces on you and we're going to correct those things. Your cardiologist, your primary care is going to put you on blood pressure medication. They're going to put you on cholesterol medication to get you down to what they would consider normal numbers. So in our office, we are a spinal correction clinic. So when we look at a spine and why we take x-rays and we do postural evaluation is because if you have a pinched nerve, then we have to locate and figure out why that nerve is being pinched. And the only way that you can do that, right? I mean, you can go to a primary care or an orthopedist and get an EMG, and that'll let you know whether or not the nerve is blocked, but it won't let you know why it's there. And it won't let you exactly know where it's coming from so you can fix it. So what you have to understand is that the spine needs to be straight from the front. I don't want to see any kind of curves. I want your hips to be level. If your hips are not level, your spine will curve as a compensation. Your spine is the perfect adaptation response. It adapts to structural load or mechanical inefficiencies that are created by all kinds of things, like simply just wearing a wallet in your back pocket can shift your pelvis and cause a curve in your spine. Your head needs to be over top of your shoulders. So I don't want to see any kind of lateral head shift, and I don't want to see one shoulder higher than the other because that can create curvatures in the spine, and those curves in the spine will create pain. The joints don't move effectively, and then those nerves eventually will become pinched and irritated, affecting your fingers or your toes, but also the organs on the other side that are also innervated by those nerves, like your pancreas or your heart or your lungs or your digestive system. This is why they say in the Journal of Bone and Joint Surgery, in an article called Curves Kill, that curves in the spine, or if you have a scoliosis over 15 to 20 degrees, it has the potential of taking 10 to 15 years off of your life, not because of the pain, but because of the neurological flow is impeded, or that those pinched nerves from those curves are going to shut off life to those organs. So we have to have a spine that's straight from the front. And then from the side, we have to have curves, okay? Now we have a thing that works against us all the time, whether or not we eat organic or read our Bible or exercise. It doesn't really, those things are vital for health, and I do those things, but gravity doesn't care about those things. So if you don't have curves in the side of your spine, then the load of gravity will destroy that spine, crush those discs, and therefore pinch those nerves. So you need to have 45-degree curves from the side of your spine, a 45-degree arc in your neck, a 45-degree arc in your mid-back, and a 45-degree arc in your low back. If you have those arcs in the spine and your spine is straight from the front, science tells us the spine can last without damage or injury for 114 years. But if you shift that spine out of place, it can create chronic issues, pain, headaches, discomfort. And if I leave that spine there over the course of time, gravity will destroy that spine. And then there's a law, it's called Wolff's Law. And Wolff's Law says that if you take a structure like the spine and you shift it out of its normal position and you put aberrant gravitational forces on the spine or the bones of the spine, then what they will do is that they will actually have to lay down new bone as a protective mechanism. This is what we call bone spurs. This is what we call arthritis. You have arthritis and bone spurs not because you're old and not because of your genetics, but because of the structure of the spine. And when the structure of the spine shifts forward, or your head is really far forward and your posture is bad, that's where you start to lay down that arthritis, and it closes the front of those joints. And then where does the disc have to go? It has to go backwards. And when the disc goes backwards, it puts pressure on those nerves. And that's why you feel the pinching or the irritation in your fingers. That's why you get muscle spasms. That's why you might have a hard time gripping things. But that also could be why it is that your thyroid's not working right. That could also be why it is that you have heart palpitations. That could also be the reason why it is that you have problems sleeping, because the nerves from your neck not only go to your organs, but they also go to your fingers as well. So structure determines function. I would also say this, Dr. B, I've heard this quite a bit, that, hey, this just happened, 6 months ago. I just started to get the symptoms of this pinched nerve. And I would say 95% of the time when I take an x-ray on that person, there's phase 2, phase 3 decay and arthritis, degenerative joint disease. It's almost like someone hasn't brushed their teeth in 30 years, and that's what their spine looks like. And I tell them, hey, I know your symptoms started 6 months ago, but this spine has been sitting in this position for probably 15 to 20 years. And they're like, oh my gosh, like, how come I didn't know that? Well, I want to explain to you why that is, and why it is that having symptoms and basically basing your health off of whether or not you feel good or not, and taking action only when you have symptoms is probably not the best way to live your life. And this is why. So the last 10% of nerve fibers are pain fibers. So you've got this nerve fiber, and the last 10% of those nerve fibers are pain fibers, which means that you actually have to neurologically create dysfunction in 90% of that nerve fiber before it actually hits the pain fiber. So, you're a young wrestler like myself, or your kid's playing football, or you got trampolines, or maybe you were in a car accident, 15 to 20 years ago, you had a whiplash injury. You went to the ER, they put you in a C-collar, gave you muscle relaxers, you have headaches all the time, and your neck hurts, but you've never really had any kind of pinched nerves or neuropathy. Now, 20 years later, you wake up and you can't move your neck. The issue started 20 years ago, but you didn't get to those pain fibers because it takes time for that to happen. So don't base your health on how you feel. Base your health on how you're functioning and healing, and that's why this process is good. And an x-ray of your spine is vital. So if you're out there and you have pinched nerves and you have neck pain or back pain and you can't feel your fingers, or you're having your hands are falling asleep at night, or your feet are falling asleep at night, or you have restless leg syndrome, please come in and get an x-ray, and I will tell you exactly why it is that you have those problems. But hear me on this. If you're listening to the radio show and you have young kids that are playing soccer or football or baseball, or, you're that mom or dad that's coming back from church and you're like, well, I don't have any of these issues. I just like talking to listening to Dr. B. I can't wait for him to get to the nutrition stuff. You need an x-ray as well, because just because you don't have the symptoms of having neck pain or back pain doesn't mean that you don't have a structural problem, because it takes 90% damage before you actually feel the last 10% of those nerve fibers. And so 100% loss of curvature in the neck can create issues, but even a ton of issues, but even 2 to 4% loss of curvature in the neck can create issues if left there over the course of time, right? So we've got an amazing opportunity for you this week to kickstart your healing journey. If you're out there, you're sick and tired of being sick and tired, I've got an amazing opportunity to partner with us, with your health, but then also with the Driven Foundation, Roy Hall Jr., Antonio Smith. That new patient appointment is just $69. It's normally $170. We're going to donate 20 of those dollars back to the Driven Foundation, and they're going to use that for food, clothing, leadership, and the gospel of Jesus Christ for families all around the city. And you get an opportunity to come into the office and get your health back on track so you can be a better servant in the community as well. It's very simple. All you have to do is give our office a call, 614-781-8808. One more time, that's 614-781-8808. 8808. Leave a message, your name, your contact information, a reason for calling, and somebody will be getting back to you quickly. You can also go to revivechiro.com. That's revivechiro.com to make a new patient appointment. We cannot wait to see you in the office. When we come back, we dive into some more awesome health stories and why chiropractic and lifestyle changes are crucial in preventing or even reversing pinched nerves. Stay tuned for the second half of Revive Your Health Radio.
This is former Ohio State and NFL wide receiver and Driven Foundation Executive Director Roy Hall. When I played for The Ohio State University, our head coach, Jim Tressel, always encouraged us to make a difference in the community. Since 2009, the Driven Foundation has distributed more than 1.3 million pounds of free food to Central Ohio families. The Driven Foundation is partnering with Revive Chiropractic to impact families. When you visit Revive Chiropractic for a new appointment, $20 will be donated to the Driven Foundation. Go to staydriven.org for more information on how you can get involved with the Driven Foundation.